Congratulations! You just found out you're pregnant, and now you're wondering, what's next? If you're like many people, you've never thought about the different kinds of care you can receive during pregnancy and birth. Most people assume that they'll just have their baby in a hospital, but there is so much more to choose from. Who you choose as your care provider is the number one determinant of how your birth turns out. The first thing you need to think about is where you want to have your baby. At home, a freestanding birth center, or a hospital. That will narrow down the type of provider that you can choose for your prenatal care. Obstetricians, with the exception of a rare few, work in a hospital setting and are experts in complicated pregnancies and birth. Only 6 to 8% of pregnancies are considered high risk and are in need of an obstetrician's level of training. The remaining 92 to 94% are considered low risk and eligible for midwifery care. There are a few types of midwives to choose from. The most common are a certified nurse midwife and a licensed midwife. Certified nurse midwives are trained as nurses first and then go into a graduate program specifically focusing on midwifery care. This is abbreviated as a CNM, and you'll mostly find them working in hospitals, although some do community birth as well. A licensed midwife is a midwife who has been specifically trained in the midwifery model of care. Licensed midwives primarily do birth in the community setting, meaning home birth or in freestanding birth centers. Licensed midwives are trained to handle many of the common complications that can arise during pregnancy and birth. A licensed midwife is also able to refer a person to a higher level of care if their pregnancy becomes higher risk. Licensed midwives carry oxygen, medications for postpartum hemorrhage, and a variety of medical equipment and tools in case a complication does arise. Pregnant people and babies are monitored throughout pregnancy and birth. The same testing that's done through obstetrical care is also offered in midwifery care. The biggest difference in care between a licensed midwife and an OB is personalized care. We really get to know you and your family throughout your pregnancy. During labor and delivery, your midwife is there for you continuously from active labor through the immediate postpartum period. Midwives provide education throughout your care and encourage informed and mutual decision-making. They also provide emotional and physical support throughout your labor process. Midwives believe that birth is a normal, natural process in a person's life, rather than an emergency waiting to happen. If you would like to learn more, I encourage you to check out the documentaries The Business of Being Born and Why Not Home. These are available streaming on the internet. You can also schedule a free consultation with Dr. Brandy Ross Bell at Moonrise Health and Birth to explore your options in community birth, offering both home birth and birth center options. Good luck on your pregnancy journey, and we hope to meet you soon.